Hello, I'm Marco Piho. I will be your nurse today, and I'm a practical nurse and I'm studying to be a registered nurse. I will be here teaching you how to correctly measure your blood pressure, and after that, how to correctly measure your blood sugar. So, monitoring blood pressure and blood sugar levels, they are crucial for maintaining overall health. Accurate measurements are essential for proper diagnosis and management of various health conditions. And we'll start with measuring blood pressure. First, the equipment that you need. You want to have a blood pressure monitor. It can be automatic or digital, and in your case we will be using an automatic blood pressure monitor, so you won't be needing a stethoscope. And the preparation you have to do is that you sit comfortably with your back supported and feet flat on the on the floor, and you have to rest for 5 minutes before measurement, so the blood pressure can lower to your normal levels. And avoid caffeine, tobacco and exercise for at least 30 minutes before measurement, so you won't be getting any false information. Then the cuff placement. Place the cuff on your bare upper arm approximately 1 inch above the elbow, and position the cuff so that the bottom edge is about 1 inch above the crease of the elbow. And you don't want to put it too snug, too tight, but it has to be a little bit tight, because when taking the measurement you inflate the cuff, and if it's already too tight it may hurt your arm a bit. If it does that, stop the measuring and reposition your cuff. So then you press start and it will automatically inflate the cuff and record both systolic and diastolic pressure readings. The systolic is the first sound and the diastolic is the last sound that you can hear the heart making. Then how to interpret the readings. Normal blood pressure usually is 120/80, and that's like the optimal. That's where you want to be. A little elevated blood pressure goes from 120 to 129/80, and that's really good still. But when going over that, there are different stages for hypertension, which is high blood pressure, and it's anything over 130/90, and then on to the next stage. As higher you get, the more reason you have to go to the doctor and think if you can do some changes in your diet or exercise, or maybe if you need to have medication to straighten up your blood pressure levels. Great. So now we'll talk about, well, do you have any questions about this? Okay, but you can call anytime when you get home if you think of any questions, and we will be answering you. So next we'll talk about measuring blood sugar. Same thing. Equipment you need is a blood glucose meter, a lancet device, and test strips. We will give you some of these for you, but then you have to buy your own test strips after this. And the preparation, you have to be clean. We don't want any bacteria, so you wash your hands with soap and warm water, then dry thoroughly. And ensure also that your glucose meter is clean and functioning properly. Then lancing. You insert a lancet into the lancing device and adjust the depth setting. You prick the side of your fingertip, avoiding the center to minimize discomfort. And the first blood drop you wipe away, and then the second blood drop you apply it to the test strip. Then the measurement, you just wait for the meter to display your blood sugar reading. And how to interpret the readings is that normal fasting blood sugar is anything from 6 to 8. And if repeatedly they are over 8 and over 10, then you will be then you will have to take insulin. And be sure to follow proper techniques and guidelines for accurate measurements, and call the healthcare professionals for interpretation and guidance. You have any questions now? Okay, thank you.